Okay, this is chapter 39 from the book, The Medical Reformation Vegan Renaissance Bible by me, Pete Rogers. We're doing a chapter on hypercoagulability. If you're following along in the book, it's page 604. And the important thing about hypercoagulability is number one, people die most commonly because of blood clots. Okay, a blood clot in the heart, that's a heart attack. A blood clot in the arteries of the brain, that's a stroke. Blood clots in the arteries to the Johnson pudendal arteries, that is a impotence. Okay, so in the movies people die from bleeding, but in real life it's usually clotting. And then also, what is atherosclerosis? Atherosclerosis is a blood clot. Okay, you can't go by conventional medical books because they're totally stupid. The books that doctors train on in pre-med, medical school, and residency, they're all stupid. They're all a joke. And how can I confidently say that? Because they never cure anybody. They stink, okay? The cure rate with a pill for diabetes, hypertension, obesity, it's 0, all right? And that's relevant because with a low-fat, low-sodium vegan diet, no oils, you cure these diseases all the time. They're easy to cure most of the time. Okay, so blood clots are the most common cause of death. All right, we talked about that. DVT, deep vein thrombosis, is a clot in the leg vein. A PE, pulmonary embolism, is a clot in the pulmonary artery, and that can cause a person to die. So here's some common causes of clotting that aren't widely known. Calcium supplements. It's thought that if you take a lot of calcium supplements, over 1,400 milligrams, because calcium is a clotting factor, you get a transient bolus and spike in calcium levels in the blood, and that's thought to be prothrombotic. And that's why women who take more than that amount in calcium supplements, 1,400 milligrams per day, that they have a 2.6 times increased risk of mortality. And it's thought to be because they're becoming hypercoagulable. Okay, somebody who has an abnormally high hematocrit, and that could be because they got a rare disease called polycythemia vera. It could also be because they're taking epoetin medicine, like those bicycle riders for the Tour de France. They might like that extra hemoglobin in the oxygen carrying capacity in their blood while they're going up a hill in the Tour de France. While they're just laying around on the couch at home resting, they're more predisposed to forming a clot in the coronary arteries and dying of a heart attack. Smoking tobacco, because of all the hypoxia-inducing chemicals in it, it'll lead to having a higher hematocrit as well, meaning more red blood cells in the blood, making the blood thicker, higher viscosity, more predisposed to clotting, so that's bad. It's also a bit of a vasoconstrictor stimulant. Cold weather causes vasoconstriction, narrows the arteries, can increase the risk of clotting. Stasis, sitting around bedridden or just being sedentary, lack of exercise, post-surgical patients who don't get moving because they're in pain, all of those things will increase the risk of forming a clot. An indwelling foreign body like a central venous catheter, central line, predisposes to thrombosis. Okay, hypertension. I've talked about in my separate lectures on hypertension how hypertension damages the blood vessels at bifurcations. And the net result is at the bifurcation median divider, you lay down collagen and that thickens the wall. And then you'll get these slow retrograde eddy currents that predispose to thrombosis and change the endothelium from being anti-thrombotic to being prothrombotic and adhesive. Okay, again, everything I'm talking about here, I've got a more detailed lecture somewhere else. This is simply to get all these things all in one spot on hypercoagulability. Diabetes leads to hypercoagulability. It increases advanced glycation end products. It glycates the red blood cells, making them less deformable, stiffer. You get a microvasculopathy from it. It injures endothelial cells. Because endothelial cells are constitutive, meaning that they can't control the amount of glucose that comes into them. So if you have chronic prolonged hyperglycemia, you'll get excessive amounts of glucose entering the endothelial cells, and that actually has a damaging effect on them, similar to what high fat does in the acute early postprandial phase, meaning that it causes insulin resistance and meaning that it damages the mitochondria. It's bad. The best paper on that is the Michael Brownlee paper called The Unifying Theory of Diabetic Complications. Okay, elevated uric acid, for example, after eating meat or high fructose corn syrup, it'll inhibit eNOS, endothelial nitric oxide synthase. So you'll be vasoconstrict. All right. It's also a bridging molecule, so it's prothrombotic. So that's important to know. The bridging molecules are uric acid, more importantly, LDL cholesterol. That's why LDL cholesterol is so bad. Fibrinogen, the clotting protein. Fibrinogen is worse when it's been activated by postprandial endotoxemia due to leaky gut. Then it's much more prothrombotic because it has an amyloid transition from alpha helix to beta pleated sheet. I have a whole lecture on amyloid clotting and all that and postprandial endotoxemia, but the bottom line is it's a bridging molecule and it's made worse by leaky gut. And what increases, elevated fibrinogen in general is an acute phase reactant protein as well. So stress, Sleep deprivation is a stress equivalent. Corticosteroid medications, another stress equivalent. And caffeine, they're all going to increase the predisposition of the blood to clotting. And the way people get in trouble is they'll do multiple of these simultaneously. They'll eat a high-fat meal, a high-sodium meal with caffeine, and they're sedentary, and they're sleep-deprived, and they're stressed out, and they're dehydrated. So they all start adding up. Okay, excessive dietary fat. Fat's a major coagulant, again, especially because of the chylomicrons and the LDL cholesterol are bridging molecules, meaning that they stick the red blood cells together and increases likelihood of forming a clot. Dehydration does it because you dry out the blood, then that has an effect of having a higher blood viscosity. Infections will do it, especially IgM antibody. That's the antibody performed in the acute phase. Inflammation, xenocellulitis from eating animal protein like the meat, the dairy. Cancer itself makes the blood hypercoagulable. Leaky gut and leaky gums because you get increased postprandial endotoxemia, meaning that you get the bacterial endotoxins into your blood after eating. From the gram-negative bacteria, you get LPS, that's lipopolysaccharide. From the gram-positive bacteria, you get LTA, that's lipoteichoic acid. And these are the ones that cause the amyloid clots. By amyloid clots, again, amyloid means the change in shape of a protein from its normal secondary protein structure to a new form. So alpha helix is like a cylinder, like a slinky. And it's hard to stack up things that are shaped like slinkies. But when you get the bacterial endotoxin interacting with them, they change and they become flat like a deck of cards, and now they'll stack up. And the bigger a molecule is in terms of its molecular weight, the more likely it is to precipitate out of solution, to form a clot. And these clots formed by, catalysis by these bacterial endotoxins are called dense matted deposits. They're much more difficult to lyse. The English researcher guy by the name of Douglas Kell with Etheresia praetorius, the lady from South Africa, they did the great research on amyloidogenic clotting due to postprandial. Prandial means eating, so postprandial means after eating endotoxemia. They got really good lectures online. They've written a bunch of famous papers on it that are very highly cited. It's brilliant work. They deserve a Nobel Prize, but they'll never get it because big money doesn't want the public knowing about all this stuff. Excessive amounts of free iron. So if you get free iron in the blood, that can be prothrombotic because it induces oxidative stress because it undergoes something called ferrous redox cycling between Fe2 plus Fe3 plus. And it has the same effect essentially as bacterial endotoxin to make dense matted deposits or refractory form of clots due to amyloidogenic transformation of the red blood cells, fibrinogen. The fibrinogen sticking the red blood cells together. It's the fibrinogen that goes on under amyloid transformation in that case. Okay, some people genetically have a high LP little a, and that inhibits plasminogen, clot dissolving medicine, to make the blood more prone to clot. But that's a little bit overrated, but just so you're aware of it. Okay, a couple more causes of protein deficient, prothrombotic clotting. If you're protein S or protein C deficient. Protein S is a cofactor for protein C. So that's sort of a genetic disease. If you have a problem with factor V Leiden factor. And then here's a couple of rare genetic diseases you'll almost never see. I never even seen that in my life. High platelet, sticky platelet syndrome. Let's see. Sodium can activate platelets, make them stickier. Antiphospholipid antibody or lupus anticoagulant. With lupus, that can be prothrombotic. Homocystinemia, these are rare things. Sickle cell anemia is not that rare. And it's worse. Sickle cell anemia is worse than sickle cell trait. If you get a splenectomy, because then you got more old red blood cells floating around. Nephrotic syndrome with the kidney problems. Birth control pills are prothrombotic. Estrogen overload's prothrombotic. Hormone replacement therapy has a prothrombotic component to it. Trauma can make somebody prothrombotic. Radiation therapy is prothrombotic. Alcohol can be prothrombotic. A high-fat meal, that's the big, most common one. Sticks the red blood cells together, so you got blood sludge. The movie at McDougall's YouTube channel, drmcdougall.com, on high-fat meal and blood sludge is really good. It was actually made by Roy Swank, the famous multiple sclerosis researcher who did a lot of study on blood flow. What's the prevention is to lower your blood viscosity, which means stay hydrated and eat low-fat, low-sodium vegan diet with no oil. Okay, I think that's just about it. Let's see here. You want to avoid things that inhibit endothelial nitric oxide. Oh, okay, I got a little more here. Okay. So we talked about the same diet like we always talk about. I got videos about Spartan vegan diet or Spartan vegan diet for a beginner if anybody's interested. Being sedentary, like if you go on a long trip, like a long plane flight, for example, be hydrated so you have to go to the bathroom more often. That'll get you moving. It's a stasis that increases the risk of clotting. Any type of inflammation, you're going to get an increase in your acute phase reactants and be predisposed to clotting. We talked about leaky gums. We talked about postprandial endotoxemia, xenocellulitis. We briefly talked about that. Prevention is, don't eat any meat, don't eat any oil, and don't eat any processed food, and manage your stress so you're not totally stressed out. Excessive stress also elevates, in addition to fibrinogen, other clotting factors like factor VIII, von Willebrand factor, and it's associated with platelet activation as well. So manage your stress, have a purpose in life, have a religion, et cetera, et cetera. All those things make you healthier. Manage your stress, get your sleep. We talked about calcium supplements in the cold weather and dehydration. Okay, so anyways, those are things that predispose to hypercoagulability, and a lot of people are experiencing multiple of them simultaneously. Again, typical thing is eat a high-fat meal like a pizza, which is also really salty, a vasoconstrictor, and can activate platelets. And then they drink caffeine, okay, and then they'll maybe eat something else with high fructose corn syrup. And then they're exposed to estrogenic toxins in their food, in their air, in their water, and they're doing a bunch of little things increasing the risk of clotting. So anyways, I hope that was helpful.